Fantastic. Hello.
Oh, we haven't face to face like this. Wonderful.
It's finally nice to meet you rather than talking on email all the time.
Yeah.
Um, Tell us a little bit about yourself and your academic research.
Well, my first degree was vet at the University of Queensland. I got very interested in physiology, and the fellow who ran the physio department uh, worked out someone who'd take me on as a PhD student in London, and that was incredible. 5 years, and I also got a DSc as well as a PhD, which is not that common. And that was because I worked out excess TNF equal disease in general as a general principle. And I got an NHMRC research fellowship here, and run by the Australian government. And I stayed inside that system for 28 years. And now I'm emeritus. And yet it's hard to renew. And I just expanded it and expanded it. If you look on my Google Scholar thing. The So I've been just having a free reign to go into mainly malaria and then sepsis and then all sorts of diseases and the brain stuff. And once it came out that TNF is normal all over the body, there you are. It's an illness,
So,
including the brain.
for people that don't know what TNF means,
Yeah. Look, it's a name. It means nothing because tumor necrosis factor that was named at the Sloan Kettering in 1975, and I got to know them, and now it's huge industry. It stops all sorts of diseases, Etanercept and the similar ones, and it's the biggest income earner actually for the pharma industry when you combine all the different types of it that are made, and it's transformed many diseases like rheumatoid arthritis is the obvious one, psoriasis and Crohn's disease. And there's others, and they're not half the minutes they were because of Etanercept or some equivalent.
Right. So how did your research lead you into etanercept and stroke?
Well, hypoxia, not enough oxygen. This is what happens in strokes.
Yep. Both strokes, isn't it? Ischemic and hemorrhagic. Both of them are lack of oxygen.
Well, yes, anything with hemorrhage, like it's fundamentally the stroke, you blocked vessel or a bleed, you aren't getting oxygen to the brain. And so you come into the hypoxic range, and TNF had to be big in stroke.
Right.
And I was only toying with that, and I was playing with malaria in Africa. But then I wrote to Ed because he was giving anti-TNF to the to patients, and he was getting it into the brain from his results. It seems straightforward enough. And so I went to see him, and I saw what he was doing with his patients was real. He isn't a neurologist, but as something I wrote to you, he actually did use Etanercept. He's actually a dermatologist, and they use it for psoriasis. And all the dermatologists knew that it made people better in the head, not all that much, but it had an effect on help their brain,
right,
in psoriasis. And he said, "I think I can improve on that." And he was playing with various ones like that, all in a private practice as a dermatologist, but he gradually, quite rapidly, when he pushed that first stroke paper together in 2011, it's a pretty shocking story, I think, because I was in on it all the time. You had no one else to talk to about it. But
so how long
yeah,
you know Dr. Tobinick for?
2011. So it's 13, 14 years he's been
Wow.
using for stroke.
Wow.
And but people come to him at his clinic now in Florida. He went there just to be with his parents, that was all. And from Scandinavian countries, Europe, UK, a lot from, even some from Greenland, because it's part of Denmark, and they send people across. You got a waiting list of months, as you know.
Yes, yes.
And it works.
So what research have you done into etanercept and stroke?
I've written about 20 large reviews. It's included all the stroke story.
Right. Are these also reviews of different papers that have been published?
Yep, they're
Here.
in places.
Right. Right.
If you look at Google Scholar, I can just send you that link and brum.
Yes. Yes. Tell me, how does etanercept interact with the brain and facilitate recovery?
It lowers you got to start by saying that the brain goes funny because too much TNF is being made by what do they call it? Microglia. They're like macrophages all over the brain. An anti-TNF, the obvious pathway, it removes that TNF, and that TNF normally keeps those microglia activated. And an activated microglia is big trouble in the brain because you got too much TNF and everything goes awry. All sorts of things can happen. It's the same with cerebral malaria. People who they hallucinate, they have all the same things they have, and in a range of other circumstances.
Right.
And I had no trouble with the malarial people because there's few and far between tropical medicine experts, specialists. If they do, they're working with everyone who's working on
it. So just getting back to how it actually works. So is it right saying that it reduces inflammation in the brain?
Yeah. Simple as that, really.
Yeah.
Inflammation in the brain is the last thing you want because you need TNF in small amounts.
Yeah.
But you don't in large. In fact,
not large amounts that have after a stroke.
Pardon?
But not large amounts like you have after a brain injury or a stroke.
For a traumatic brain injury and stroke, they all follow the same pattern.
Right.
And they are the obvious external manifestations of too much TNF in the brain.
Right. So I was doing some research on this, and etanercept has a very high molecular weight, and so it can't pass the blood-brain barrier. So how do they facilitate that?
Well, what Ed started doing when he was at UCLA was the whole basis of that, and said, look, if you go in at the back of the neck, you get into an area there where you have reverse flow, and you can get, if you give it to the right area, it'll drain into the brain as long as you tilt the patients. That's what the tilting is for, to allow it to run in, put the head forward a bit and then back and all of that. Ed's really secrets that neurologists refuse to see.
I mean, obviously, you know that I've had the shot.
Yes.
Like I had the treatment, so I know what it feels like having the injection and experienced the whole feeling of the etanercept going in and stuff like that. But I'm curious, like I obviously had a really good reaction to it, but there are patients that don't have any reaction. And I remember when I was first contemplating having this done and asking people, you know, online if anyone had done it, I was getting a really, really aggressive backlash about even considering it. Because people were saying, well, you know, I paid all this money, it didn't work for me. So do you have any thoughts about why it does work for some people and not for others?
Yes, because in stroke, normally they say it couldn't possibly work because that area dies. It becomes scar tissue, a glial scar, they call it. Now, if, yes, sometimes some areas are like that. You can't do anything about those areas that are absolutely died in the brain.
They're gone. Yeah.
But if they're suppressed, they're merely gone into hibernation. And this fits the hibernation literature and bears up north and all this, incidentally. If your brain is in fact gone into hibernation, you can reverse it. But if it's scar tissue, you can't reverse it. There'll be a proportion like that. That's why he's trying to look carefully at the patients beforehand.
That's interesting. So is it the inflammation that causes your brain to go into hibernation?
Yep. Mild inflammation, and it goes into hibernation. It suppresses thing working, and then they reverse.
So obviously my brain was in a type of hibernation.
Yeah.
And then it was woken up.
Yeah. And you could have some areas that were dead tissue.
Yes, well, I have. Yes, I've seen my MRI.
And they are dead tissue.
Yeah.
But some people have that badly, and you won't do anything about them. But that's not very many in comparison.
Right.
I've been to New Zealand a few times over this, talking to people in Dunedin and in Invercargill, groups of people who have been treated by Ed. And
Yeah.
there's very bright people in some of those places. They're incredible videos of those patients there. Yes, that's the gist of it. That you hibernating and reversal hibernation compared to just simply dead.
Yeah. And that's why some people just have no reaction to the medication at all.
Yeah, because the neurologists say, well, it's all like that. So we got to start again with all these exercises for years and their little machines and it's their whole livelihood.
Right.
And it's a shock to them that their livelihood can, in many cases, in most cases, be reversed by just a simple injection.
Well, I mean, just from my own personal experience, I just before I had the shot, it was going down to Florida, and then coming back with two completely different experiences at the airport. You know, going down there, I had wheelchair support, I had noise canceling headphones, I had an eye mask, I had a medication for anxiety. You know, it was terrible. Coming back, and that was 24 hours later. Coming back, I was just like every other traveler. I was
Yeah.
walking normally, you know, all the noise didn't bother me. Yeah, and that's sort of, you know, continued to this day. And you know, I often get asked by people online, how do you know this isn't the placebo effect?
Well, you're asking me that?
And so I'm asking you that because
Yeah.
one of the things that's really sort of got me thinking is that University of Melbourne study that came out just a few days ago that said there's no real, you know, difference between having a shot and having a placebo. My research into placebo said that placebo doesn't last very long. So usually only
Yeah, it didn't last very long either. That's the other point.
a few hours or a few days, and I would have been back to the way that I was before. And I certainly at the airport, I wouldn't have coped at all. And so, you know, I just can't accept the placebo, um, you know, answer because you know, it's been 6 months and my improvement's been constant over 6 months. And also I've been able to do so much more than I could do before I went to the States. Almost living a normal life. So yeah, I just find that whole placebo thing, you know, if it only lasted for the few days after I had the shot, then yeah.
Well, the trouble is to prove it's not a placebo, you've got to have a lot of money. You've got to have a large trial funded by the big farmers. And then you can formally investigate it.
Yep.
If it was placebo effect, all those people in Melbourne who are treated by those people there, they'd be showing placebo effects. Well, they say that it was no different. But my objection to the whole thing in Melbourne, I did email you on that. I'll just drag it up and block here. That it won't remember what I was saying. Yeah, that no one who was giving that injection in Melbourne, they're not known. They were just volunteers from inside that have a go. They've never seen Ed give the injection. Oh, yeah. And also, none of those people had seen any of Ed's patients. By definition, neurologists don't look at Ed's stuff. They never have. And
So I looked at their paper that they presented in Europe, I think in April, and so they said that of 136 people, half of them received etanercept, half received the placebo, and of the people that received etanercept, half of them reported less fatigue, less pain, feeling better. Half reported nothing, and they're exactly the same result with people that received the placebo. So, I thought, well, okay, fatigue, that could be placebo. Pain is the same, and I had both, and both are gone. But for me, both stayed gone, and also I had sensory overload that went away. I had issues with my hand mobility. That is so much better. My hand doesn't feel like it's moving in molasses anymore. The emotional regulation, literally in like from 1 minute to the next, went from me not being able to regulate my emotions to me being able to regulate them. Those kind of things, and my speech improved like dramatically. You know, you just can't attribute all of those things to placebo.
Well, there's a perfectly good literature on all of those that fit. It's a vast. TNF, when I was playing on it first, there were 3 papers on TNF. They were barking up the wrong street. They're all about tumours. Now there's, I think, 225 or 252,000
Wow.
on it. That's a record thing. No other cytokines, they call that class of things, cytokines, is anything like that.
Wow.
And it's a vast literature, and this is what I've been keeping up with. And it can rationalize all those changes in science, and they do a lot of stuff in rats and mice and all that. They're not picking up any. It fits like a glove. And TNF's universal. It's coral makes it. Reef coral makes it TNF. The same TNF as humans do.
Wow.
Reef coral TNF can recognize human TNF receptors. Sponges, same. Of course, fish. It was a great thrill when it was in people as well as TNF, and then in dogs as well, and horses as well, and fish as well. Big thing in the fish industry.
Right.
Or when they what's the word? Breed salmon in places they shouldn't, make a mess, and all of that. But all those diseases, that's all TNF based.
Wow.
It's a big world.
Yeah.
And to say, no, that's just what people think. They don't know any of that in the world. There was a paper, well, see, we got emails they were passing to each other. The head of the UCLA set up, he sent an email to each other buddy pals that work on all this sort of stuff, and they know each other internationally from papers. He said, I don't suppose there's any reason, I've got it, I don't suppose there's any reason how anti-TNF could help in stroke, is there? Now, that 5-year-old has asked that sort of question. There's infinite number of people out running in the TNF world who just laugh. That's in a million ways.
Mm.
But for them to say, and they're the ones that rule the roost because they're the neurologists, they don't need to know any science at all. I don't suppose there's any chance that TNF could help, is there? And that's their level of knowledge.
I I have been sensing since I undertook this whole Etanercept journey, um, the resistance to this, either from people I was just asking for advice, have you had it done? How, what was the result? Through to trying to talk to my doctor or trying to talk to my stroke specialist.
Oh
Um,
God, no! Oh, they
I,
carefully. They've never seen it. They've never seen the outcome. They don't talk about it.
Yeah, they either don't know anything about it or just said, make sure that you have, done appropriate research and you know what you're doing. Um,
Well, uh,
and when I got back, you know, the my doctor immediately, like the week I got back, he saw me and he saw the change. And still there was this refused refusal to acknowledge that something was better. That had
well,
worked.
the one in Dunedin like that. The woman there, very articulate. She wrote about her husband to a neurologist who'd seen him before, and also her and her physio lady, his physio lady, um, said, I can see, the physio lady wrote a spiel that she stuck in it, that he's changed. He's absolutely different. It's a physio class, and he's a different person. And that sort of feeling has got into the Scandinavian world, because they put people in who've had a stroke, and they need a lot of exercises, and that they they see them, they blossom if they've gone to Ed's place and come back and join the group. And so they say, well, you ought to go, and you ought to go, and you ought to go. And this was what happened. This is why an awful lot of his caseload comes from Iceland and Sweden and Norway and Denmark.
You know, I've been trying. I mean, I am trying to remain really objective as I can about this, even though I personally had the experience. I personally had benefits from it. I'm trying to look at both sides and or the research and everything and keep an open mind. Um, about this whole thing. But the question I often get asked, especially by someone who's considering the treatment, is is what to advise them. And what do you think? So if someone came to you and said, "Look, I'm thinking of, going to see Ed and getting one shot or two shots," what would you say? How would
Um, I haven't any way of finding out whether they've got any um, scar tissue when an area is dead
yeah,
in the brain. And I explained about that. If you're not too bad, and you can be reversible, quite reversible.
yeah,
And but if you've already got big areas of the brain, and you can pick all those on MRIs, um, they aren't going to come good. They're dead. You
yeah.
might as well be
So,
pouring a Etanercept over.
if you have an MRI, can you see the level of inflammation that's in the brain, or can you just see the dead area?
You can really pick the dead areas. I'm not too sure.
Yeah.
Um,
So so like when I've advised, I've said, look, it's either going to work for you or it's not. Um, but and I knew that going in, but I had to do it because I had to know in my heart I had done everything.
yeah, there's so many people I've known who've done that and said that. Um, the interesting couple in Invercargill, they're both senior detectives, husband and wife, and he had a stroke, and he was a very good rugby player, and he used to train the New Zealand schoolboys team or something like that. He realised he can see out of his other eye, and he's going like that with his eyes, like close. What? And anyway, then they give him a glass of orange juice to see if he can taste it for the first time for a long time. And he had a wonderful expletive where he just said, and they didn't want him to take it off him. He was tasting something for the first time.
That happened to
Now,
me.
a really nice fellow.
Yeah, I had the same
I
thing.
went to their house in Chicago.
That was me when I got the orange juice. It was because part of my tongue had been numb for for 2 years to taste it, and going afterwards for about 2 or 3 weeks afterwards, everything I tasted was so bright, was so vivid, the flavors.
That woman said when he took her husband up and down the streets in Los Angeles, it was running his practice there then. He wanted to go in every specialist spicy restaurant there was.
Yeah,
But he hadn't tasted any of those tastes for so long.
yeah, I can absolutely relate to that.
And he's saying in Invercargill, look, I used to have to take him home after 3/4 of an hour. He couldn't keep up walking around the streets anymore. Now he outdoes me.
Wow.
He wants to stay out and go around town.
Yeah.
Um,
The other thing I often get asked, and
yeah, yeah.
by people asking me, about it since I came back, but also, that I was curious about is the high cost of the treatment.
Yeah. Well, he's got to run a practice there and the various people, as you know, and set up. But those drugs, the like Etanercept, if it's past FDA for a treatment, it then becomes a cheap drug.
Yeah.
But if it's not passed by FDA as a treatment,
That's off label.
They charge what they like.
Right.
Those big farmers. I mean, there's a lot of raw stories about it.
Ah,
And books on it. They can nominally say what they nominally say now is about 7,000 a pop. Here, you've been able to get a COVID vaccination anytime you like, whether it's in or out of the sequence of where you get it essentially free. But if you insist on getting it, you can pay about $7,000 for it.
right.
That's the price they put on it.
Yeah. That's
and then Ned's got to pass that on because it's not past FDA.
So it's the pharmaceutical company that's charging these thousands of dollars for this drug because it's using off label. Yeah, that makes sense. That makes sense. Yeah, I must say that when I read the paper over the weekend, like a couple of days ago, it really did upset me because their results were not my experience.
Yeah.
And it was suggesting that, well, this is all in your head. This is all literally, but also this is all placebo. And I was struggling for a few days thinking, well, have I been lying all this time? Have I been making this up? But I've had family and friends tell me that I am profoundly different since I came back from Florida.
Yeah.
I'm back to the Andrew I was like pre-stroke. And for me, the confirmation came actually yesterday when I was asked to by a friend of mine. He's a music teacher, and was sick, and could I come in and take his classes? Now I haven't stepped in front of a class since before the stroke, and I was able to go in there and teach 12-year-old boys who are, bouncing off the walls, and not have a meltdown and not, not have any effects of the stroke, affecting my ability to teach. And that's when I knew that this is real, because there's no way I could have done anything even remotely like that before the shot.
Yeah. There's a very good one I've got. The family who's videoed, they don't want that to be publicized. So, but I've got the full video from Ed, and he was saying in a gruff voice, they gave him some uh, water to drink. Oh, it was just so painful, his neck and swallowing and all that. He said, it's like chewing crushed ice. Dry. It's like chewing dry ice when they gave him an orange drink. It was so painful. And within a period, and Laura kept in touch and all that, that she was talking to Ed, and then about her experiences, and then she looked across, and there he was over the other side of the chair, but with the camera wasn't on him. But she said, he's over there doing push-ups. Got out of the chair himself, and he's doing push-ups just to prove he could do it to himself.
Wow.
And he'd been an absolute court case. And
Yeah, I think that's a pretty good story to finish with.
how about I send you a couple of key papers? I know that you won't. It's not your field at all, but
I do read. I do read them, and I do understand them as well, because I've been sort of immersing myself on the world of
yeah.
Etanercept and TNF and this kind of thing. So I will definitely read them with interest.